Welcome everyone to this webinar on dental HIPAA compliance and cybersecurity made easy. Today I have with me John Zanazzi, who's the CEO of San Diego HIT. I'm of course Neel, Kothari, the COO of PracticeWeb, but I'm very happy to welcome John, and he's going to give us some great information regarding HIPAA compliance and cybersecurity. We would, if you're watching this on YouTube, we would love for you to like this video, subscribe to our PracticeWeb Dental YouTube channel, and click that bell icon to get notified whenever we share more webinars like this and more tutorials and other great content on YouTube. So please do like the video, subscribe, and enable your notifications, especially if you're using PracticeWeb. And even if you're not using PracticeWeb, you'll get great information here. Like today's webinar on HIPAA compliance. Now, a legal disclaimer is that HIPAA requirements are detailed and complex. So this webinar cannot possibly cover everything. We're just touching on a few areas that we feel are important for you to know about. That's one thing. Another thing is that we're not providing legal advice here. So although we will talk about some HIPAA laws, we're not going to provide direct legal advice to you. Please do consult with your attorney to get that official, legal advice. But with that, I wanted to start by mentioning the fact that healthcare data breaches are very common. And the types of breaches that we've looked at here, just to figure out what is the cause, the biggest by far is a hacking or IT incident. So we're going to cover some points related to that later in the webinar. Another is unauthorized access or disclosure. Another is theft, and as well as improper disposal or loss of data. So those last three, a little bit less common, but it's still an area where we've seen data breaches and have been reported to the government. When we're looking at dental practices, and again, these are just the reported ones, the ones where the federal government has investigated and found data breaches. There's many more than this out there, but in 2021, the reported ones that we found were about 14 and impacting, unfortunately, 161,000 patients. So again, we see a year-over-year increase of 27%, and patients impacted is even more than that. So the reasons behind those breaches are the unauthorized access or disclosure to patient information, as well as hacking or IT incidents. The violations are definitely destructive to your practice. Hopefully none of you experience them, and that's why we're doing this webinar. But just one example, there was a dental practice called Elite Dental Associates, and that they had to pay this fine because they were reported to the Office of Civil Rights, Department of Health and Human Services, because they were basically talking and discussing patient information in response to social media reviews, social media comments. And so a connected point is that that office, perhaps related to this or maybe unrelated, but it's no longer in business. And so, like I said, HIPAA violations are very destructive. We want to stay on the right side of the law and protect our patients' privacy. The other thing here, which creates a lot of risk for your practice, is that anyone can file a HIPAA complaint. There's no requirement that this person's even a patient of your practice. So it could be a patient, and it could even be, in some cases, it's been patients who have just observed HIPAA violations happening in the office, even if it didn't directly affect them. So maybe they were aware of HIPAA and these regulations, and they just reported some apparent violations when they saw them. Another could be a vendor, even a vendor that's working with you could potentially complain about your practices. It could be a competitor down the street, or like I said, a bystander, someone who just saw what's going on, even like on a social media forum, like Yelp reviews or something. They could report you for violating HIPAA.
So you may say that, well, if they file a complaint, it might be a very, very minor thing, and we just have to address that minor complaint. For instance, we had one doctor's office that was, they had two people in the waiting room. One was John, and they were both named John Smith and John Jones, say, for instance. And they called John Smith, and John Jones was the person who they really wanted. So he got angry and filed a complaint. Now, when they got the complaint, the initial complaint was, thrown aside real quick. But the issue is that once the complaint is filed, now the OCR is free to investigate anything they want with respect to HIPAA. So there were so many different issues that, and there's no such thing as being HIPAA compliant at any given time because it changes. So you have to be really careful. You have to be ready to go. And that's one of the things, is that even if they file a complaint for one thing, they will investigate you for anything that they feel free for.
So dental offices, one question, kind of a preliminary question, is, am I even covered by HIPAA? So I've heard dentists say, luckily none of our clients, but I've heard dentists say, well, I'm not subject to HIPAA, or I'm not under their purview. But that is highly unlikely nowadays, at least in 2021. Dentists are covered entities under HIPAA and have to comply with the full extent of the law as healthcare providers if they electronically transmit health information in transactions for which the government, in this case, Health and Human Services, has adopted standards. So that's a lot of lingo, basically saying, if you engage in any electronic transactions like insurance claims or real-time eligibility checks, where this is governed by HIPAA, then you are a covered entity. So long story short, that's essentially all of you here, unless you're completely, not doing any electronic transactions like that. So what are the laws that will apply to you as a covered entity? There's 4 major ones. The privacy rule, which covers the protected health information and how you can disclose or when you cannot disclose that information. The security rule, which relates to kind of protection of electronic patient information. So we'll touch on that a little bit today. The breach notification rule. So if something goes wrong and there is a data breach, how you are required to notify your patients and any other required parties of that breach. And then lastly, the enforcement rule of how the government will levy fines and penalties if you have violated any of these rules. So those are the 4 major areas. We're going to start on the privacy side and how to protect patient info, some areas to be aware about. Now, HIPAA essentially forbids unauthorized disclosures of what's called protected health information. So essentially, it's individually identifiable health information, whether it's electronic, paper, or oral. So it's not just the stuff you have in your system, but it's also oral. So discussions of health information that's individually identifiable. And there's 3 areas here. The first is physical or mental health condition of the individual, of the patient. The second is treatment, related to treatment. So demographic data related to these 3 areas I'm going to mention. First is the physical or mental health or condition of a patient. Second is treatment of the patient. And third is payment related to that treatment. So those are the 3 areas where demographic data relating to these 3 areas is covered as PHI. And that information can be used to identify this individual. So what does that mean? That information that can be used to identify the individual. There's some examples I have here, and it is very broad. So those of you who think this is a very broad definition are correct. It's not so narrow as just X-rays with a patient's name on it or a billing statement. It's a lot more broad than that. So examples are the name of the patient, the address, birth date, their SSN, driver's license, phone numbers, chart numbers even, if they can be used to identify the patient in relation to your practice, and patient photos. So these are all just examples. Again, if you are all dealing with this information, and if it can be used to connect that patient back to your practice, and it relates to those 3 areas of healthcare, the health condition, treatment, and payment, then you're dealing with PHI. Now, what do we do about that, right? So this is a cartoon just kind of making light of it a little bit, but we don't have to go to extreme measures. We can still operate our dental practices and not make this a very burdensome thing. HIPAA tries to be reasonable to an extent in that respect. So what are some areas to just be aware of? It is a minefield, but I think if we are just have some systems and procedures in place, then we can do a good job of complying. So just some things to point out here, the sign-in sheet. So a lot of you know that it used to be that we would have a sign-in sheet where just kind of a continuous sheet of paper where you just have folks sign in and you're fine. But The HIPAA compliant way of doing this, because essentially you don't want patients who are checking in after previous patients to see the previous patient's name and information there, especially first name, last name, etc., and birth date. So I've seen where there's sign-in sheets where you peel off the previous patients who have signed in, and that way it's a very compliant way of doing this. Of course, you can also use other electronic methods to do your sign-in, which is compliant. Like we have an iPad app called NLive, and so that NLive app can get your entire sign-in process as well as the patient forms done through the iPad. So no patient is going to see another patient's information because they're going to be logging in separately every time. The waiting room, again, this is kind of related, but the waiting room is just a place where you want to be really careful. The check-in, check-out process, make sure it's one patient at a time. There's no conversations that can be overheard by other patients in the room or in the waiting room. Especially even during checkout, a lot of times there's kind of a line that forms of maybe you have 2 or 3 patients checking out at the same time. You want to seat the other patients and do it one patient at a time. Paperwork and charts. So if you have anything in paper, anything physical, charts, just make sure that it's not visible to other folks, especially patients who should not be seeing that. Another reason to go paperless, as mentioned, if possible. Staff verbal discussions. This is an area where it's easy to violate because you just might be having a conversation in the front office between team members, and folks in your waiting room can overhear that. So you want to be careful when discussing things verbally among your team regarding patients. Listening to voicemails. Sometimes folks will put voicemails on speakerphone, office voicemails. So they're trying to catch up on things and multitask. So they're listening to patient voicemails on speaker, and now other patients might be able to overhear that information. So be careful there. And then on the flip side, leaving voicemails. So if it's a patient's cell phone number and you've been authorized to use that cell phone number by the patient, it may be okay to leave voicemails there that have some information. But to be safe, especially because you don't know who's going to listen to those voicemails, it's good practice to simply say, this is a call from your dental practice, who you are, your phone number. Just keep those voicemails kind of short and sweet. Computer privacy. So just similar to paperwork and charts, computers can also be a risky area, because if patients can see, other people can see information on your screens as they're walking by, then now you've again exposed that information. So if you have that risk, then maybe have those privacy screens that they have available for computer monitors. Unattended log off. So I'm going to discuss how to do this in Practice Web, but you want to make sure if you walk away from your computer for an extended period of time, there should be an auto log off, so there's no exposure of data that way. Emails. So and John, you can chime in on this. I don't know if HIPAA specifically requires encryption, but emails can be risky, because if they're caught in transit by a hacker of some sort, and that is a way that you could lose data to a third party that's unauthorized. So the good standard to follow is using encryption or using some other secure form of messaging, which I'm going to get into how to do that in Practice Web. But anything you want to say there, John, about sending?
Sure. So HIPAA does not specify that you have to have encrypted email. But it does specify that if you're using unencrypted email, you have to notify the patient, and the patient has to agree to receive unencrypted email. So, for instance, if you're sending out, X-rays to a patient, they can, and they, for whatever reason, if it's and they don't want to deal with, unencrypting it, they can say, look, can't you just send it to me in unencrypted form? And you can, so long as you send them some sort of notification and you get it in an email saying that this patient knows that it is not encrypted and is willing to risk it, to have the risk of unencrypted email.
Yeah, and I think the gold standard is really using secure or encrypted email, secure messaging or encrypted email, which we'll talk about. The final thing I want to mention here is handling patient data. There have been a lot of cases, and we're going to point to one later on, where you could have data on like a USB drive and it gets mishandled or gets stolen. Or, I also read a story where a medical office had given a bunch of their paper records that they wanted disposed in a in a HIPAA compliant manner, actually, to a third party, and then that third party dumped it in a bunch of dumpsters, like behind a church or something. So that was later found and then reported, and then that office was fined heavily. So whether you're disclosing data or you're hiring someone to do it, make sure it's HIPAA compliant. And if you're handling it, taking it home, etc., there's also some things you have to do there to be careful. So those are the areas I wanted to touch on. In terms of disclosing patient info to third parties, also a tricky area. There are times where you can do it. There's times where you may need consent, and there's times where you shouldn't do it. So when you can do it, and again, this is not comprehensive, but I wanted to point out some common areas. So there's a area where, treatment, payment, or healthcare operations, you can disclose patient info or protected health information for that purpose. There's a minimum necessary rule. So essentially, you only want to disclose what's minimally necessary to accomplish your objective, whether it's treatment, payment, or healthcare operations. Now, those three terms are defined in more detail in HIPAA, but we're not going to cover that today here. But this is an area generally where it's allowed. Patients of minors, this is just kind of an area that comes up, especially for pediatric practices, etc. So you have legal guardians, you have parents, you have court-appointed guardians. So there's some nuance there. HIPAA generally can allow this type of disclosure, but there may be state law that you have to check to just see if there's additional requirements in this area. So there's some tricky areas where it's not so clear, but for the most part, this is allowed under HIPAA. But just check your state law as well if there's additional requirements. Friends and family in the presence of the patient. So let's say a patient comes in with another family member, maybe not the parent, but another family member. The good practice is just asking the patient for verbal consent and just make sure that they're okay that you discuss certain information in the presence of that other family member or friend. And also there you should be, even if they say yes, just be careful in how much you're disclosing and make sure that it's authorized by the patient. Now, transfers to patient representatives, maybe someone else calls in or emails you or contacts you to get patient information. Again, parents and those type of folks might be exception here, but generally you want to get written authorization from the patient. And that written authorization, there's a very specific kind of consent form that you need to get, or authorization form. It's not just kind of, yes, please go ahead and transfer. There's some requirements there, and you should just make sure that you have the proper form there for written authorization. Website and testimonials. So a lot of times you do and you should put testimonials on your website, but if you're going to really reveal like first name, last name, photo, get written authorization from the patient beforehand. And you can do that in your forms, as in your regular forms that they fill out when they're a patient of your practice. And then social media, this is one area where it's very, very common nowadays with all the Yelp reviews and Google and Facebook. And someone might talk about how bad the treatment they got was, or how bad their overall experience was. And your instinct is to correct them and just say, no, actually, you came in the other day and this is how well we treated you, etc. That is essentially a no-no. You don't want to disclose any of that protected health information in your social media replies. And especially also with posting on social media too, similar to the website. But when you're replying to reviews, the best practice is just to say that this is our regular process in our office, and this is what we try to do and keep our patients happy. There's kind of a generic reply, but specifically whatever points they mention in their review, you can reply with, here's what our standards are. Here's what we always try to do for our patients. And that would be a good reply because it's not revealing anything regarding that patient. Now, with HIPAA compliant messaging, I alluded to that earlier. So with PracticeWeb, as long as you're on the latest version of PracticeWeb, this is not an extra service that you have to pay for. There's a secure message service, so you can do that in PracticeWeb, and we have some tutorials on this, and you can also call support if you need help getting this going. But there's a secure message option in the email section there, and you can type up your message to the patient. It gives you a confirmation, and then the patient will get an email saying that you have a secure message from your office, and then they can log into their patient portal simply and then read that message and also reply to you as well, and you'll get those replies in PracticeWeb. Now, next point, kind of related, is another sort of communication you may be having that you don't want to get hacked as well, are video calls. So teledentistry is definitely on the rise. We did a whole webinar on this, which will be linked in the YouTube description below. But there's a big trend in teledentistry, and so we definitely want you to be able to get on that wagon and use teledentistry, because it's so effective for dentists nowadays, whether it's smile consults, post-care follow-up, doing like an initial triage for emergencies. So you do want to have this tool in your toolkit, but you should try to be HIPAA compliant there as well. We do have a service called pwTeledentist, which is very, very low cost, and it's a great way to do this. And you're going to be using your dentist portal and patient portals on both sides to have a secure video call. But there are certain services that are not HIPAA compliant, so just look into that and just check what you're doing on that aspect. Within the team, so this is a kind of an important area, which I think is an area of violation for a lot of folks. You want to restrict the access and uses of protected health information based on the specific roles of your team members. So within PracticeWeb, for example, you want to make sure that you have restricted things properly there. Each employee should have their own login in PracticeWeb, and that is important, because whether it's for the permission side or the auditing side, it's just a very important thing to comply with HIPAA. And then also, if any employees leave the practice, you should deactivate their logins just as a protective measure there. Now, when I talk about user permissions and user access, under the security settings in PracticeWeb, there are very detailed user permissions that you can set up. So the way that works is every user belongs to a user group, and the user group is where you determine what they have access to, what they can view, as well as what they can do in PracticeWeb. And so that is going to be where you want to be careful and make sure every user is in the right user group. And there could be situations where maybe you have a part-time person working from home, or just coming in once in a while doing insurance verification. So that person may need very limited access, and so you should maybe even create a special user group for Sally, the person's coming in for insurance verification. So you can create an entire separate user group for individual team members as well if you need to. Once you have all those users set up, make sure that you follow a couple of things. These are all options. If you go, let me go back here. If you see at the very top there, it says global security settings right near the top left of the screen. So you want to click there, and it'll take you here. And you can do a couple of things. First, make sure that passwords must be strong, meaning they can't be kind of simple sequential passwords. They have to be strong. So it's a requirement that's enforced there. And you can even require a special character like an exclamation mark, an @ sign, etc. So the stronger your passwords are, it's going to be just safer to not get hacked or have improper use of other usernames. And then another thing you could do is require everyone to manually log in their credentials, just another way to protect from other people using, the wrong username and password. Automatic log off. So I mentioned this earlier. So you should have an automatic log off set up so that if you walk away for too long from the computer, it'll log off that person. And then lastly, this is just a good practice for data integrity. You could have a global lock day or date. So let's say 3 days after you put in a procedure note, it's locked, no one can change it. That's more for data integrity, but I think it's in the same line of keeping that information protected. Audit trails, there's a great way in PracticeWeb under Tools, Audit Trail. You can check all the activity that has happened, and you can even look at any specific activity and filter based on that. So this is a way to sort of see who's dealing in what information. Especially if something goes wrong and you see some unauthorized use, you can look at maybe who did that. And again, another reason why you should have users for every team member, so you can track it down. So with that, John, I wanted to turn it over to you. So if you want to share your screen, and you can talk about right of patient access.
Sure. Okay, so next slide, please. So, Basically, when somebody asks for a record set or wants their records, you have to have a list of the things that you give to each patient, regardless of what the patient is. The idea being is that you can't differentiate between one patient versus another. So you have to have this in writing on what is going to be included each time the patient asks for a record. It could be their billing and payment records. It could be their insurance information, whether or not you sent it to the insurance company. It could be their lab results. It could be their images. Anything that has to do with their management files. And, it would have their clinical notes also. You have for those of you who are not in the state of California, you have 30 days to comply. Now, here in California, we actually have our own little form of HIPAA. It's called the CMIA, which is the California Medical Information Act, and you have 5 days in California. So just be forewarned that, some states may differ. So the request policies, you can ask, they can be a written request, they can be a verbal request, and there is no set gold standard for requesting the information. Basically, the idea being is that whatever you see fit to do that, to ask, sometimes if they ask for something on the phone, you can have them ask for 2 pieces of identification. Like Neel said before, if they're in person, you can ask. It just depends on the situation. Okay. And then as for charging the patients, typically you can charge whatever you see reasonable. There are some guidelines on there. It's like 50 cents a page and things like that. But the idea being is that you can charge anything you'd like. That being said, typically it's not going to cost you that much. You probably would be best off just to, give the patient records for free. Most of my clients do not charge at all.
So I can talk about this part, John. So in terms of, I think some of you will know this, but how do we share records from PracticeWeb? It depends. Like John said, it depends on what they're asking for. If they want the whole thing, then there's a couple of places where you'll need to go to produce that information. But if they want, let's say, their chart clinical notes, in PracticeWeb, you can go to the Show tab in the dental chart, and then you can select under procedures and object types what all you want to give them, and usually err on the side of more than less, because this is their patient information, protected information. So once you select what's showing in the progress notes section, you can right-click on that lower section, and there's a print progress notes option. And you can also print that to PDF if you need to and send it that way over to the patient. If they're asking for something like their payment history, their account information, you can create a custom. It's called you go to set statement in the top right, and then you click on the more options screen, and there you can do the whole history, get a statement generated for that as well. You also have information in the imaging section. You have treatment plans. There's a ton of stuff. In the family section, there's the insurance plans. So it depends on what they're asking for, and if they want everything, then you'll just have to generate from those 4 or 5 areas. So that's just a mention regarding the sharing information. Go ahead.
Thank you. So I always like to talk about, with respect to ransom and computer security, when you install the internet on your computer, you're actually moving your office into a very bad neighborhood. There's a lot of bad actors out there and bad people who are trying to get into your network. One of the things that can happen and has been happening out there is ransomware. So we're going to talk a little bit about the things that you can and you can't do to help to alleviate the types of ransomware that's out there. So how do you know you have ransomware? Well, let's just say you walk in to your office and you see this beautiful picture on there, and your monitor is flashing and it's saying your data is encrypted. Pay this amount in bitcoins to get your information back. So we're going to talk about the ways in which you can go through and make that a little less. So the first thing that that you may run into is you'll get an email, and so they get in there, and you get an email, and it says something to do with accounts receivable on your email account, and you'll click on it, and it'll be a PDF, and inside of the PDF they've embedded different types of links on there, and you click on one of the links, and lo and behold, you download a program onto your computer, and it encrypts all of the all the data on your information on your computer. All your information is encrypted. Okay. Another way is most of you, I don't even know if aware of this, but if you're using Facebook or typically Facebook or any sort of other social media, sometimes you'll be downloading different links, and if you're not sure on where the link is coming from, you could actually download the ransomware on there. So you also want to be very careful about downloading anything via social media. You really shouldn't allow your office staff to use social media while they're on, the company computer. And another one that I see typically is a lot of doctors, to help out their patients, will put unsecured links on there, and they'll have the username and password for their Wi-Fi, and it's the same network. The patient Wi-Fi is the same network as the other Wi-Fi, and they get into the practice this way. I've actually seen an office where they had their username and password in front of the window, and they had an unencrypted Wi-Fi right outside in the window, and obviously they're making it quite easy for people to get into their network. You've all heard of the IRS out there. You can click on this. This is actually a bad link. You may notice that there's different links. There's different things that are spelled incorrectly on the link. If you hover your mouse over where it says get started or the link, sometimes it'll have an entirely different website than the IRS. You just have to be really careful about clicking on anything. This one right here was Costco. You may get emails from your banks, typically banks where you don't bank. Amazon is another one. So anything where a lot of people are getting links and emails and things like that, anything that a lot of people get, you run the risk of having some sort of bad link. One of my patients, after a nice long day, three-day weekend, walked into her office, and there was flashing screens, and it wasn't my client while this happened. But she became my client after it happened, and it said your data was encrypted. Please pay a certain amount, and it was actually $5,000 in Bitcoin. The doctor decided to negotiate with the bad guys, and she got them down to $3,000, and it took and she paid the Bitcoins. She downloaded the information. It took about 3 weeks for her to get 60% of her data. Once she got 60% of the data, the person said, "You've only paid 60%. Please give us, more." They gave it more, and so they had to give the other 40%, and they wound up paying the $5,000 to get their records back. You just want to be really careful about ransomware. Okay. So you want to have some sort of game plan, and you have to do this before it happens. So the first thing is you want to appoint the security officer, and typically, unfortunately, that falls upon the office manager. I know the office manager is probably the busiest person in the office, or one of the busiest persons in the office. You want to perform a risk assessment. We kind of alluded a little bit to what that is. By law, you have to have one every year. What it does is it goes into your practice and it sees where your vulnerabilities may lie, and it also talks about ways at which you can alleviate some of those risks. the time, I always say that if you're trying to restore something at 3 a.m. and you're not sure if it's actually going to happen, you might have a problem. So you want to make sure you have a disaster recovery plan, which, by the way, is something that you need to have by law, and you have to check them. And it's okay, if you do them your own backups typically, but you want to make sure that you check them to make sure that they come. Typically, whenever I get a new client, 60, 70, 80% of the time, we try to restore their data, and it doesn't happen. So please make sure that you have a good restore process. And then you have to have written policies and procedures. We talked about if somebody files a HIPAA grievance against you guys, or a HIPAA violation against you, you have 15 business days to get a list of things on there. One of them is a risk analysis. Another is written policies and procedures that are specific to your particular practice. So please make sure that you have them. We recommend that you work with it doesn't necessarily have to be a local IT provider. You can work with anybody, who understands what it is. HIPAA compliance, they talk about, it's kind of a pain. You have to do it. The government, I don't want the government in my office and things like that. But to be quite honest, HIPAA compliance is actually protecting you. The risk analysis will let you know where you're falling flat, or where you need to increase things. And then if you have the risk mitigation strategy, you want to it'll help you to save your practice. With and as a IT provider, I can help to explain. People don't really understand what a firewall is, and being from a educational background, I'll help you to explain what it is. But how a firewall can maybe protect you from the different malicious software, or have some sort of staff training on there. One of the things that that I see out there in the IT world is that a lot of these offices, they don't update their software or do patches, because typically one update will break two things, so they won't update them. And and as an IT provider, I'm going to give kudos to PracticeWeb, because some of the other players out there, when they do updates, they kind of break things. I've never run into that situation to where PracticeWeb, one of the Windows updates, broke something. So I love working with PracticeWeb for that particular reason, among others too. And then you want to make sure that you have really good access controls, not only on your on PracticeWeb itself, but also on your network controls too. So what are you going to do once something happens? You don't know who to call, you don't know how to call. A lot of things with respect to backups, what happens if your IT provider is not around and you need somebody to restore the data? Do you know how to do that, or somebody in your staff knows how to do that? If you have to restore the data, how many hours or how many days can you afford to be down? So the first thing is you want to go through and you want to detect it. Believe it or not, there's been cases where the bad guys were inside of different types of networks for over a year before they were actually caught. The second thing you do is, when you have one, what do? Do you turn the computer off? Do you reboot it? Do you disconnect the network cable in the back? I'll tell you a little hint right now. In the case of some sort of cybercrime, do not reboot the computer, because that will erase some of the files that you may need that are in the RAM. At the very least, what you want to do is just disconnect the computer from the network. Eradicate it. You want to run software. Can you get rid of it? Is it hiding? You want to run the best, make sure that it's gone. And then again, restore the data. How long is it going to take for you to get back up and running? While you're fixing it, do you have a plan B or a plan C, whether or not you go old school paper charts or that kind of thing? And then once it's done, you talk about how it got in there, and you talk and you figure out ways so it can't go back in there again. How do you know that you're under attack? The first one is that You know, you'll see the flashing signs, or your computer will get slower. The big one is that when you go in there, you can't get access to it. It won't allow you to have access to it. You'll get emails. All of a sudden, your screen will pop up with a thing saying, you know, call Microsoft to make sure that your computer is okay. Guys, ladies and gents, I have to tell you that nobody, including myself and Neel, are important enough for Microsoft to call personally on their computer. So, you know, 99% of the time, it's pretty much a scan, and then activate the incident response, providing that you, of course, do have one. There's actually a utility inside of PracticeWeb to run your backups and restores. It's actually a pretty slick little application. If you want to put them on a flash drive and take the flash drive home with you, there is also a way to encrypt the data. So please make sure that your data is encrypted. If you take it off site, you could back it up to the cloud, where it will be there in case of an emergency. We recommend both on there. And then there's actually a tutorial on YouTube where it'll help you to make sure that your data is backed up properly.
You can also, another thing that I don't know if everyone's doing this, but you should test your backups, like John said earlier, by using the restore option. So when you restore the data, which is this kind of the bottom portion of the screen, the backup screen, that way you can check if the data is good or not, the backup data. So that should be done once in a while as well.
So we talked about the carrot. Now we're going to talk about the stick. And I'll make this really, really quick, but there's different levels of HIPAA violations. There's one that there's no way you could have known about it, and you violated it. You can get up to $100 per violation and up to $2,500 annually. Maybe you should have known, so if you notice, it goes up to $1,000 per violation. Willful neglect, so basically, willful neglect is something like I'll get around to it, but then you fix it, and then willful neglect is where it's not corrected. And basically, there was a case of a doctor in Arizona where he was told to change his password. His password was password, and he said, "I'm not changing it ever." And they wound up charging this little tiny. It was actually a cardiology practice, $1.5 million. The penalties that are worse than that are that you'll actually have to have the government over your shoulders for 1 to 3 years with a corrective action plan, making sure that you're doing what you should be doing. These are examples of letters that I downloaded from the internet for different types of clients. So unless you're prepared to write this letter where they're committed to protecting the security, you really need to get, the HIPAA compliance going. And like I said, guys, anybody could find these. Here's another letter from the Dr. John Gonzalez. Notice that I didn't, there's nothing is redacted. It's the name of the doctor. It's the name of the practice. It's the phone number, everything. Okay. The wall of shame, do a search for wall of shame. So anytime you have a violation, of a HIPAA violation, you actually have to post it online so anybody can have access to it. In addition to that, most states have their own state of reach one where you also have to post your information. And even though it's a federal law, the state attorney generals can actually prosecute HIPAA. So I'd love to work with each and every one of you, especially for those of you working with PracticeWeb. It makes my life a lot easier, but we'll help you. The idea, the way in which I consult is I'm kind of different than most other IT guys in that anything that I do will move you towards HIPAA, and we will do everything in a HIPAA compliant manner. One of the things that is most people don't have with respect to people who are doing it is a business associate agreement, and I will definitely sign a business associate agreement with each and every one of you to work together so that you can become both seamless IT, working all the time, and working your HIPAA compliance. And if you want, I'll give you a free disaster recovery. I'll remote into your computer, with your permission, of course, remote into your network, looking down there, making sure that your backup is okay, making sure that you have nothing brewing, making sure that you're patched, and that's a $300 value. And I'd be happy as a user to this person. And that was actually somebody from the webinar calling me already. So, believe it or not, but for you guys, no charge.
Perfect, John. And then for just quickly for PracticeWeb, as we discussed earlier with the importance of updates and upgrades, if you're not on support, definitely get on support and you'll get the latest upgrade, which has all the security that we talked about earlier. And you also get a lot of other great services like dentist and patient portals for that secure messaging, practice analyzer, mobile forms, and tech support to help you implement all of the strategies that we talked about today. So that's a great offer right now. You save $240 a year with this price, and that expires the end of this month. To sign up for that, you just simply go to our website, the pricing page, and then there's a renew support button on that page. If you need help implementing any of the strategies that we talked about today, just reach out to your support team at PracticeWeb. You know where to call. You've done it before, I'm sure. And the number's there, 800-845-9379, option 2. And the email support@practice-web.com. There's an even easier way to contact us. Just go to the help menu in PracticeWeb, click on remote support. You can drop us a line from there and we'll get in touch with you very quickly. Another thing I want to say is definitely keep learning with us, see these events, certainly on YouTube, but also on Facebook, LinkedIn, Twitter, and our blog on practice-web.com. There's tons of great content, great for training your team, great for keeping your team up to speed on the backbone of your dental practice, which is PracticeWeb, at least from the software side of things. And I think I just want to end with saying you've got this. I know HIPAA is complex and detailed. We covered a lot here. I want to thank you for joining us today for this webinar. I want to thank John for giving us a lot of great insight from the HIPAA and IT perspective. And there's the contact information for both of us if you want to reach out directly. We'll see you soon. Thank you very much, guys. Goodbye.
Thank you, everybody.
Thank you, John.